Good afternoon, all. Hope I'm audible and clear.
Yes.
Thank you, sir. Thank you for confirming. So, welcome to the last day of our development program. Uh, Honestly speaking, we at Palem India have been really enjoying this particular batch because of the lively interactions. So today we will be having discussions on end of life care as informed earlier. Without much delay, I hand over to Dr. Sreedevi to further take it up. I'm over to you.
Thank you everyone for joining us. Now we know the activity. Probably we can reduce the group work time a little bit and we can come back to the feedback session soon. And I would like to spend the last 10 minutes or so for getting feedback from you and a few ideas how to go ahead with this kind of programs. Because as mentioned in the first session by Dr. Rajgopal, the aim of this program is to reach all the medical colleges, train at least to have a few trained people in all the medical colleges so that this will be taught to undergraduates. So that is the larger aim of this program. So maybe a last 10-15 minutes, it will be great if you can all pitch in and give us some ideas, or if there is anything that needs to be changed or which you felt will be more effective or was not really good about the session. We are happy to take a few critical feedbacks. So probably we can wind up in the group work in 20 minutes. We were taking 30 minutes last time. 20 minutes we can wind up, and then 25 minutes, and then we can come back to the larger group. So we will choose 20 minutes is fine, I think, because now we all know the topics and what is expected in the group. Yeah. So we will choose the presenter for each group now. Over to Shri Priya. So this is for group 1. Dr. Varsha.
I'm there. Yes.
Okay, Dr. Varsha. So you will be presenting from group 1. Dr. Prakash. Can't see Dr. Prakash. Hopefully he will join the group 2. Or I hope you will not waste time waiting for anyone. Someone can take up. Who was there yesterday, probably he'll be joining. Dr. Madhu. Dr. Madhu has not joined.
Maybe I can speak.
Yeah, I think we'll fill it again to avoid confusion. Dr. Varalakshmi. We'll wait to the next. We'll move on to the next group. Dr. Shweta.
Yes, ma'am, present.
And probably the last person. Dr. Sucharita. I remember seeing you now.
Ma'am, one request. I'm Dr. Varlashmi from Group 3.
Yeah. Okay.
Can I present first because 3:45 like that I've been bus, so it is difficult to present,
Sure,
ma'am.
definitely.
From
yes.
the bus.
So you're from group 4, right?
Okay.
Yeah.
Group 3, ma'am.
Group 3. Okay.
Thank you.
Yeah.
Yes, ma'am, I'm there.
Okay. Great. So I think there is 1 or 2 groups where we did not get the presenters. I hope they will be joining, but I don't want you to waste time for waiting for the presenters, but please start the discussion. I'll be in 2 groups, so I'll be swapping between 2 groups because one of our faculty was unable to join today. So now we'll move on to the breakout rooms. In another 20 minutes, we'll come back and then we'll start discussing.
Of life care. So it is 2 hours class. So we thought the set induction we'll do with the newspaper cutting of Aruna Shanbhog case. And in that regarding what happened in the Aruna Shanbhog case and what was her condition in detail, I mean, that newspaper cutting we'll put. And we thought of dividing the students into small groups. And we'll ask each groups to come up with the ethical issues in the form of a word, each word, like whatever ethical issues they are seeing in that cutting, and let them discuss in detail. So that will be taking around 30 to 40 minutes, followed by which we thought we'll have a class, a didactic lecture class with the objectives describing the basic principles of ethics and how these ethical issues helps in the management and prognosis of the patient in end of life. One thing, and other objective is to discuss the latest medical legal guidelines of end of life care. So we thought this lecture we will do it as an integrating lecture with taking anesthesia and forensic medicine. And we thought of ending the class with the assessment. Initially, we will be giving a pre-test and the post-test. This is what we discussed. So mainly a case scenario followed by a lecture with the pre and post-test.
Would like to hear from other participants because we all know that this is a little confusing or little sensitive topic when we talk about legal and ethical issues in end of life care. So, how to avoid miscommunication when we talk about this to students? Like, what are things that we need to think of before delivering the session?
I think before the session, there should be a planning. And in that planning, whichever faculty involved in palliative care, and if there is no faculty as such in a college, at least in your neighborhood, if there is some doctor practicing palliative care, they should also be included in the discussion. You can even put it as a panel discussion sort of thing if you feel that there are some areas.
Yeah, it's very important to, as you said, there is a high chance of communicating wrong information or getting a wrong idea from these kind of sessions, specifically on end of life care or ethical and legal issues. They might ask a lot of dilemma questions also. So you have to make sure that the person handling the session is really equipped with knowledge. They might have done practically this in their setting. They've gone through all the legal and ethical issues. That will be great. Or as Madam told, maybe panel discussion is a great idea because then you can invite a few experts and then we can have a discussion. That's one way of going ahead, utilizing these many hours for students than maybe asking them to come up. I have seen people teaching this particular topic and getting confused with when they get questions from the participants, like they really don't know because they have learned but they have not practiced. So that's one thing about this particular session that you need to think of.
So, and in the panel discussion, we can even include a law expert on law.
Yes, we have done this once in a medical college where we had, as sir mentioned, we had an expert from law. Then we had a palliative care expert, a critical medicine person who actually practices this on ground, and an oncologist and a neurologist. So this was one panel discussion that we did for one medical college, and it went really well because students will ask all sorts of questions. Lot of surprising questions they ask, and it is very important to get the answers from a very authoritative people. Otherwise, there is a chance that we may not be communicating what we really want to do. Panel discussion will be a great idea so that we can ensure the interaction and we don't have to worry about our view being conveyed. We can have multiple people on. Thank you, Dr. Varalakshmi. I think next will be group 4. Yes, Dr. Shweta.
Yeah. So from group 4, the topic given was therapies used in alleviating suffering in patients at the end of life. So for this will be for the final year students, for which the duration of the class is about 1 hour. So we had planned to have a pre-test before the class for 5 minutes, where we would give some 10 questions to the students so that we can assess the knowledge of the students about the palliative care, like the conditions which might require the palliative care and what all therapies, means what all care they might need. This will be for around 5 minutes. This will be followed by a didactic lecture class for around 30 minutes, which will be covering about the pharmacotherapy and non-pharmacological methods which are required for the end of life care, and also includes the psychosocial support which the patient as well as his relatives need, and also how to take care of the patients regularly, not only the therapist, the regular care like the minimum examination and all, how it is done. All this will be taken in a didactic lecture class for around 30 minutes. This will be followed by a video demonstration where the actual video, the students will be shown how the patients are taken care of, like the therapies which includes the death rattle situation, the nausea, vomiting, or the GA symptoms, how they are taken care of. This is for around 10 minutes. This will be followed by a post-test where the students will be assessed about the class, what they understood and all. And this is how we conclude the class. This is for 1 hour we planned.
Thank you, Dr. Shweta. I'm just concerned about the duration. I'm not sure whether we can cover all these topics in 30 minutes.
This is for
right?
1 hour.
Yeah, but your didactic was for 30 minutes, right? Where you're planning to cover the pharmacological, non-pharmacological, as well as the psychosocial issues and continuity of care. So that might be very difficult to cover in 30 minutes because there will be a lot. So any other ideas from other participants? How, Dr. Shweta, you can mention your topic also so that others can. What was the topic for your group?
Therapies used in alleviating suffering in patients at the end of life.
So should we start with some trigger activity to make sure that what is the importance of alleviating suffering when someone is dying? Why should we alleviate suffering anyway? The person is going to die, right?
Yeah, that will be.
I'm just asking. That's one thing. Everyone will think. Why should we? What is there anyway? We know that the person is dying, so suffering is bound to happen. So maybe to start with something, I don't know what it can be. It can be a trigger question or some scenario, some short video. Maybe the video that you were planning to show, maybe a clip of that in the beginning. What do you think do we need to address suffering while someone is dying? Why should we address suffering? Something like that. Just my thought. I would like to hear from other experts also. Dr. Parul, Dr. Sunil, or Dr. Baburaj, how this is a very broad topic. So
I was thinking about the uh, short videos regarding how at the end of the life care, at the home setting or at the hospital setting, uh, why it becomes important, especially for the caregivers also and for the patients also. Uh, short videos at all the settings we can show. That will be a good idea. And I also believe that 1 hour class will be too less for this topic. At least 2 classes.
Okay,
I'm
ma'am.
not sure. Where in the first class you have
Actually, in the module, it's mentioned as
Yeah.
1 hour, ma'am.
okay,
Actually, in the module, it's mentioned as 1 hour.
okay,
That's why we were also confused, actually.
okay.
or maybe ask them before the lecture to think about someone who might have died in their family or neighborhood, or anyway they are final year students, they might have seen people dying in the wards. What are the common symptoms that they have seen? What kind of deaths they have seen? How was it managed? Something to brainstorm from before the session, so that the context is there now. Setting the context that there can be symptoms when someone is dying, and it has to be something which is traumatic for the family to think about. There'll be at least a few of them who might have seen deaths in their family usually. So, and just a thought to save time, probably one activity before.
I mean, the reading material also will be good enough. The theory part, if they're planning to do that in the PPT form, we can provide them the theory part and make it more interactive or video presentation in the class.
In a life limiting illness, when the death happens, I don't think students will be able to and internalize that there can be symptoms which can be a little different from the usual setting that they see. There can be breathlessness, but it is different from what they have seen. There can be secretions or delirium, which they might have seen all this in different diagnosis, but they'll be seeing that in a very different mode right now, and the goal of care is also different. So maybe somehow to set the context that why it is possible to have a lot of symptoms when someone is dying, and why it is important to control those symptoms. 1 hour is very less time to deal with such a very important topic.
Yeah, since the module mentioned it was 1 hour, we planned it accordingly.
Maybe you can set the context by hypothetically saying, supposing they are final year students, no? Supposing one of their relatives, they hear that they are nearly dying and suddenly they are called saying they have some symptoms like breathlessness. What will you do? So in such a situation, what to expect and how? So maybe you can set a personal context like that. They can be called, it always happens. Somebody will call, oh, they are in final year, please come and see what to be done for somebody at home and at the end of life. So they feel that it is important for them to know.
True. There will be at least a few who might have seen or who might have been called to such situation. I can see a chat from Dr. Varsha telling that they might have seen people dying, but they might not have seen suffering of terminally ill patients. Probably, if we start integrating what we have been talking in the last 2 days, they might have seen one or two patients in the ward, at least in the ICU, probably when they are posted, having relatives going through a difficult time because of not everyone might have seen, but you can ask for, as madam said, maybe one person in the group might have had some experience and then start from there. The key is to make them understand there can be symptoms and the management of goal of care can be different, and really need to treat the symptom even if they are dying. Yes, Dr. Shivapragasham, flipped classroom session will be best because this is little too long, big topic to be covered in an hour. But I think it is expected to be covered from the time they start seeing patients, to understand the transition of care, the goals of care, everything. We expect the new curriculum would have covered that by the time they reach this part. Thank you so much, Group 4 and Dr. Shweta for presenting. Moving on
Thank you,
to Group 5.
Our group's topic is grief and bereavement. So we have actually planned this topic for final year MBBS students with the duration of 3 hours. Our specific learning objectives will be by the end of the session, the student should be able to define grief and bereavement, should be able to describe the stages of grief, should be able to identify complicated grief and refer whenever necessary, and describe the do's and don'ts as a treating physician, and to demonstrate how to help family members cope with the loss. So the first hour, we thought we will first talk to the students about and ask them about their experience after following the loss of their loved one, which will be for 15 minutes. And following that, we thought we will start with a interactive lecture through a PowerPoint presentation, where we will include all our specific learning objectives, which we had mentioned. And the next class will be for 30 minutes. We will ask the caregiver of the person who has already grieved in the past, and then we can call them and ask them to give a guest lecture about their experience, how they successfully coped up with the loss. Or if the hospital has a proper palliative care unit with the bereavement support group, then we can take the students in small groups to those sessions to just observe what is happening in the bereavement support groups. This will be for 30 minutes. The next class we had planned for 1 hour 30 minutes. Our group member suggested a movie. Dr. Anupama ma'am suggested a movie called Wait. It's a Hindi movie, so we can show them either the clippings or the entire movie, which is based on grief and bereavement. Following that, we can have a discussion on the movie and various aspects of the grief and bereavement and how to cope with that.
Thank you, Dr. Sucharita. Any other comments from others, faculty members or participants? This will be a new topic, right, for students. Will they be listening to these kind of topics when they have the psychiatry posting?
Yes, I think so.
Yeah, ma'am. Even I was thinking that we can initiate this topic in the psychiatry clinical posting, and just for the sensitization.
So as a part of postings, we are teaching them the skills for communication, the skills for empathy, and the skills for these breaking bad news and everything. But grief and bereavement as such, we did it under ADCO module only. And then we tried to bring back all the points that we taught in those to connect to how they would address when it's actually being done. So I'm a faculty of psychiatry, so I'm speaking.
Sreedevi, I think maybe this can be introduced by telling a story. It may be like this. Ask all the students to maybe close the eyes, and then the faculty will tell a story. The story would be something like the one of their close relatives who is very young. Then maybe they were going to somewhere, and there was some terrorist attack, and you have been hearing this news in the TV, and after some time you get a news that this person has died. So let them close their eyes for 1 minute more, and then ask them to open the eyes and ask them to tell what are the reactions that they had. So there will be many emotions through which they go, and somebody may tell that, I couldn't believe. That would be something which, through which we can actually go through the Elizabeth Kubler-Ross model of loss, and the grief reaction also.
Anyone has tried any other methods to teach grief and bereavement? The idea of if you get a caregiver to talk about their experience, that will be wonderful. If they are not willing to come and talk, probably a few recording of what they have described as the loss, or maybe to start with by asking most of if some of them have pets, what did they feel when they lost their pets, or what did they feel when they lost their favorite something. So you start from loss and then grief, and then taking them to the next level. It's again all today's topic are a little difficult to convey through didactic. So it has to be a very interactive and like a story based or activity based lecture. Yeah, showing them a movie is also a very good idea. Again, if you don't have time, if you can give the link, tell them to see the movie and come back with some reflection, that will also save a lot of time.
We did what Sunil sir has suggested,
Yeah.
but we did it with COVID example because there were a lot of people who lost a lot of people they knew or people they had in families or friends to COVID. So that is one thing we did use, but there was fair warning before we started the class that the topics are going to be a little sensitive, and if anybody was feeling uncomfortable, they could just raise their hand and leave the room.
Yeah, that's also a very important point whenever we talk. Sometimes in sessions, there might be some student or someone who will be having a personal experience with death and grief and everything. So it can make people uncomfortable. Even not just students, even for the other sessions, some people get uncomfortable. So make sure that they are all okay in listening to all these sessions. Thank you, Dr. Anupama, for adding that very important point.
So we can even include the doctor's role in grief and bereavement of the family members.
Yes.
So he should be empathetic towards the family members.
Yes, yes. During the process of dying and taking care of everything, and then sometimes we forget about taking care of the family members once the patient is no more. So that's again very important.
I just would like to add that yes, counseling of the medical personnel also is maybe a part which can be included because most of us during the time of COVID, many of the doctors also had to undergo counseling and like dealing with, and many of us in ICU who work routinely in ICU, doctors go through stress, and they also, that's also.
Even Dr. Parul is telling to provide them sources of student wellness group and renters. That's again, as Dr. Priya mentioned, it's a part of self-care or some kind of counseling. I'm not sure whether that is included anywhere in the new curriculum. Maybe you are the experts. I have not seen anything like self-care or counseling for students or even faculty members. Thank you so much. Moving on to group 2.
Good evening. Good evening, all. Hello.
Yes, we can hear you. Please.
As Dr. Prakash is not available today, myself, Dr. Raina, is going to present. And our topic is common issues encountered in patient at end of life and its management. So we are going to teach for final year students, and around for 75 students we are going to teach, and it is going to be a 2-hour class. And our SLOs are at the end of the session, the final year students should be able to describe palliative care and hospice care and explain concept of total pain, and they should enumerate common issues in patient at end of life, and they should describe pharmacological and non-pharmacological management, and they should be able to demonstrate the management for end of life care issues. So this is our SLOs, and it contains knows and shows of components of the similar study. So our main session, it is going to be like we are going to give topics before the class, like a day before the class, and they should read and come like a flip classroom method, like we are going to start. And on the day of class, we are going to start with the setting section where the students will share their experience, where either from their home or during all these 5 years, whatever they have seen in their hospital, all those things will be shared, and we will discuss about that. And that will be done for 10 minutes. Or else we also plan that we can play a video where this common issues is shown in the video. So that also we can discuss about. Then we are going to have a lecture session, which is going to be an interactive lecture session. That will be for half an hour. That's what we plan. So which includes hospice and palliative care, and concept of total pain, and common issues at end of life in detail we are going to cover here. And also we're going to teach about the fluid and food, that what we have to give, and pharmacological and non-pharmacological management. So all these things will cover for 30 minutes. Then we are going to have a buzz session where again a video will be played, and which will be about common issues in the end of life care. And here we are going to discuss more about the pharmacological and non-pharmacological aspect, where these things will be provided in the video. That will be for 15 minutes. And at last, for 5 minutes, we are going to do the prognostication in life care. So with this, the first hour will be over. So for the second hour, what we have planned is we are going to do a role play. So in this, as we have already told the student to read and come about all the topics. So we are also we will be training few students for the role play. So whoever is trained, they will be come and perform. And other students, we're going to ask questions depending upon the role play, and they have to answer all the questions. The role play, we are thinking about nursing care, how to give nursing care for the patients. So this will be around 50 minutes. At last 10 minutes we are going to have for attendance. At the same time, we can also ask the students to give the reflection writing, and that can be done after the class also. So this is how we are going to plan for the 2-hour session.
Thank you, Dr. Praveen. I think maybe earlier we discussed the therapeutic approach to patients on end of life care. So with this lecture, there will be a context already, like what are the issues that they face, or so the group who have presented on therapeutic approach, they don't need to focus on what are the issues, but they can have a quick recap and go on to the management part quickly. So this is really important to understand what all are mentioned and how we should maintain the flow than everyone doing everything on end of life care in all the lectures. So one common problems they have covered, and next lecture you can cover the therapeutic approach, and then next lecture grief and bereavement. You don't need to cover all the, I think there is another group on specifically on pain management. So when you are talking about the therapeutic, you can avoid talking too much about pain management. Rather, you can focus on other symptoms like breathlessness or secretions or terminal delirium, etc. Would like to hear from others, faculty members or the group members.
Actually, our group was a little confused because this topic had come for group 2, and in that also management is mentioned, I think. So we were wondering whether palliative sedation was mentioned. Then we knew that palliative sedation, we are not expected to go in detail with the undergraduates. So we were a bit confused regarding to what exactly to say in our session. Because in the previous one also management was given, no? How to handle that.
Yes. Any other comments? We'll move on to group 1 then. Can you unmute and talk, Dr. Varsha?
Can you hear me?
Yes, yes.
Hello.
Yes.
Good afternoon. My name is Dr. Varsha. I'll be representing Group 1. Our topic for today is principles of pain management in terminally ill patients. The target audience for this is the final year MBBS students. The SLO for the class is to at the end of the session, the students should be able to understand the importance of symptom relief in patients who are terminally ill. Also, they should be able to enumerate pain, types of pain, and also they should understand pain in terminally ill patients. Now, initially for set induction class, we will start with an audiovisual aid, which will be previously given to the patient, to the students priorly 1 day before coming to the class, so that they can see and we can save time on seeing the audiovisual aid in the class. The audiovisual aid will be a short video about 10 minutes. And once they come, they will come to the class. Initially, we'll start discussing about the audiovisual aid. After that, we'll be having an interactive session with the students for about 20 to 30 minutes, where we'll be discussing initially about the introduction. In the interactive session, we thought we'll make it like an integrated teaching class with the anesthesia department, where we'll be talking about introduction. We'll explain the importance of pain management in terminally ill patients, impact, how pain impacts the quality of life. And we'll also talk about understanding pain management in terminally ill patients, where they'll be taught, we'll be discussing about the physical as well as the emotional factors contributing to the pain in terminally ill people. Then principles of pain assessment also will be given importance. We'll be talking about it for 10 minutes, where we'll emphasize the importance of individualizing pain assessment and meeting the patient's need and depending upon their background. So also, as I said, we'll be discussing about types of pain. And also at the end of the class, what we'll do is we thought we'll give us case scenario, properly formulated good case scenarios will be given. Around 4 to 5 case scenarios will be given. We'll divide the students into groups and we'll give different case scenarios to the students. We'll give them about 10 minutes to discuss among them, and then they can present the case scenario and discuss with the audience. This is what we thought.
Thank you so much, Dr. Varsha. Maybe again, when you talk about pain management here, you need to emphasize on specific doses and medications like opioids, maybe a recap of what they have learned. They might not have seen people actually using opioids after the pharmacology sessions. We're not sure, depending on which institution they are in, whether the institution uses morphine for pain management. So maybe you can do a little recap on all this and how important it is to control pain, and what can be is there a need for dose regulation, alternate routes of management. In end of life, you can't talk about giving orally, etc. And how to manage if they are in the community, probably. What if they want to go home, and how are you going to manage the pain adequately when the patient is at home, not in a hospital? I think all these will come under this particular topic. Any other comments on this topic?
Use of different pain scales in assessment. Especially
when someone is dying. Very good point, sir. Like now we talked about all the scales where people can verbally tell many things, but when someone is dying, how you can use the pain assessment, how to do the pain assessment, that's also very important. Thank you, sir. Any comments from the experts, Dr. Parul, Dr. Baburaj, or Dr. Sunil?
No,
Thank you, everyone. I would like to, sir, Dr. Baburaj, please.
Because we need to emphasize on symptom control during EOL, because these are all budding doctors. Lack of this understanding is the main reason for taking these patients to the ICUs where their signs are treated nicely. BP is treated, saturated is treated, but their symptoms are not treated. So actually, doctors should know about this particular fact. So we need to highlight the importance of a dignified death and free of symptoms like pain, delirium. Maybe in a hospital, maybe in the home care, to make the students understand, because they are going to practice in future.
Thank you so much, sir. As
is there a chance to include advanced medical directive in the session? And because I think that would be good somewhere in this 5 topics.
Yeah, I think, sir, I think generally the time given for all the end of life care topics are very less in the CBME. But maybe someone was mentioning about, we were discussing about having a panel discussion. Advanced care plan will be a good fit for the panel discussion, where we are discussing the legal and ethical issues, and then you already have a panel of experts there. We can include one topic as advanced care planning, so that we can start discussing and ask questions how it is to be done with the experts probably. And if any of you plan to do such panel discussion and you need people to represent these as panelists, just kindly write to us. We'll be able to put you in touch with respective faculty members who do such discussions in institutions. So just kindly let us know. We can help you with that also. And that will be an awareness for the entire institution actually. Now a few of you are trained, and once you do such a session, it will be an awareness for the entire institution. All the faculty will be listening, okay, there is something which is legal about all this, and they will also be interested to learn. That is a kind of sensitization that you can know in your institution also.
Dr. Sreedevi?
Yes, Dr.
Hello?
Yes,
just wanted to add that we have done something like this in our institution. We have spoken about end-of-life care in the part of our CME. So that was a group CME. So that led to a lot of questions and a lot of interest in understanding the end-of-life care concerns, especially in our patients. So yes, so that is a very nice way of suddenly introducing a topic among lots of people, especially among other specialties.
Thank you for sharing, Dr. Priya. Yeah, that will be a very good awareness and sensitization among the other faculty members. Starting to have such discussions on end-of-life care will be a good idea. If you are purely based on the classroom discussion, it will remain in the classroom. So if you are organizing a 1 hour session, probably can get hold of a lot of other departments also into it. So
thank you.
Thank you so much, everyone, for the last few days. But I would like to hear from you honest feedback on this program, and what more you need to start teaching it from now onwards. We have given all the resources, but is there anything else? I've seen Dr. Puneet's request on a list of movies that can be shown. I remember one group of foundation course have come up with a long list of movies that can be shown. I'll just go back and check. But here what we use is the WIT movie. Dr. Raina showed a clipping of the WIT movie, but it is not available to download or to watch. We used to get the DVDs from other countries. It was not available online. WIT is the name of that movie. Someone mentioned about Patch Adams for the first years, which is an English version of Munna by MBBS. So that's one movie that we think about. And sometimes we use so there is a YouTube channel for NHSRC, National Health System Resource Center, NHSRC. In that, there are many videos done by us that is specifically for communication, 2 videos on good and bad communication, and it is available in Hindi and in English, which is free of use. There are certain nursing procedures, lifting, shifting, how to take care of the skin of bedbound patients. All this is available in that YouTube channel, both in Hindi and English. There are more videos to be uploaded in the near future in that. So that's one set of videos that we use. I'll check whether you have a link to short videos, which Dr. Rajgopal will be talking about various topics. It's all 5 to 6 minute videos specifically for medical students, which we created a few years back. If you did not get access, I'll give you, I'll make sure that there is access to those videos. Anything else regarding the structure of the whole program or the content? We are happy to improve in the coming sessions.
Madam, I got one question.
Yes, doctor.
Now we are told that we have to teach for the undergraduate students.
Sir.
So where will we get the PPTs to show the students regarding palliative medicine and all? Where will we get the PPT resources?
Sir, in this drive that we have shared, the PowerPoint is also included. In all the topics, you have the PowerPoints with the notes. Each slide will have notes underneath, like otherwise new person using the slides will be difficult. So we have people who have written notes under each slide. Use this slide and tell the people to students to discuss this for 5 minutes and then come back. So all the instructions are also given in the PowerPoint.
If you want to take class on palliative medicine.
Yes, sir. All the PPTs are shared, sir, in the IEGO platform.
So much materials have been given. I was about to compliment. I don't know how much time you spent giving so many materials on one side. On the other side, I wanted to say, don't spoil people by giving so many materials.
We are giving everything so that at least then people
actually,
should.
I had to sit one whole day to download them. Sir, I had to sit one whole day to download them. So you have to spend at least 2 hours to look at how much material they have given. So it's not you go there and click and everything is available. So it takes time because they have put in different sections, different folders on different topics. So even they have also given on one link with movies, but then I was seeing that if the other group had anything to say. One last thing, since we are all talking about electives now, so me and Dr. Sreedevi also spoke about it. So next FDP, can you take up one elective module?
Like one session on electives, how to
maybe, yeah.
Yeah, we can. Sri will you note it down? Yes, we can do that. We actually thought about including one session on teaching methodologies, but I understand you get enough and more training on various teaching methodologies periodically, right? As a part of the medical education unit. So that
Yes,
we
ma'am.
avoided.
Nowadays, training has become compulsory, and many colleges have been training about it because everything is new. So I don't think most of us are also innovative from the discussions you could probably hear of, right?
Thank you so much, Doctor.
Madam, I got one question.
Yes, sir.
So you told that the videos are available, but when I went through the IECO, the videos of FDP of this foundation course, they are not there. They have been deleted.
No, sir, it will be available.
Sir, if we did, maybe we can take up this later after this session.
We'll check once again whether it is still available for the foundation
No, madam,
course.
now they have been replaced by this faculty development program videos.
No, sir. So you will have access to 2 groups. Now you will have access to 2 groups. You will be a part of the foundation course. So that is a different stream. Now you will be a part of the faculty development program also. You will have access to both. So once you enter the FDP, you will see only the FDP part. Once you enter, so there will be two courses. Now I think you will be shown the course you have enrolled in. So you have to choose which course.
Okay, okay. So both are available now.
Yes, yes, yes. If you are enrolling for another program, you will be having access to the three course. So multiple icons will be there. You have to click on the right one.
So after this FDP, I can get the
Yes,
videos
yes.
of both I can get.
Yes, yes. You have access to it.
Okay, okay. Thank you.
Madam, I think you have been talking about 8 core modules because communication has been a part of a major chunk of palliative care. But have you also thought of theory classes and any clinicals? So why not now, since palliation has become a kind of specialty course? So since you have been working on it, and then I see a lot of modules. So did you ever think of introducing palliative care as a module, since already many things are there? But then bundling it up. So for example, if we call anesthesia, we have a set of curriculum under anesthesia. So I have recently had an experience in my own specialty, like introducing a sleep curriculum. Similarly, I think we can all put our heads and probably try to bring up a curriculum. I think with many of the people here also very experienced and quite close to NMC, they can propose it that this can be a curriculum because already it's there bits and pieces in many places. So I think this is some discussion if you can take up.
Yeah, the main challenge right now is that, as Dr. Rajgopal mentioned, only 40 medical colleges have a department in palliative medicine, or even a faculty, any kind of palliative care services, and there are like 708 medical colleges. So when such things comes up, there is no one to take ownership. There is no department. There is no OPD.
No,
So
no, ma'am, no. I think I'm if I can just interrupt, because this is a UG module and most of the basic things we are all there. Kind of ENT people are there for tracheostomy, other symptom care. Everyone is there, but then only these people have to come together in different modules. Maybe an integrated class where anesthetists will come in, where other oncologists will come in. Then it forms a class. Already things are there. Only it has to be put in a one format and say that, okay, this is the palliative curriculum.
You're telling it is now scattered everywhere, from the foundation to internship, various departments, various modules, but instead one stream with giving ownership to departments. I think a little bit change has happened in the 8core module. They have clearly mentioned which department is responsible for each. I think Dr. Sunil, it happened last
They
month,
withdrew
right?
it again. They withdrew it again. They sent one more notice that.
Yeah, it is. Yeah. So those kind of clarity will be good for this. I agree. Totally. But we are glad that at least palliative care is mentioned in the medical education after so many decades. But as you mentioned, if anyone is close to NMC, that will be helpful for us also. At least because now it is included, but as you know, there is not enough trained faculty to teach all these topics. That's why we are offering foundation course so that you all will get an idea what it is all about. Otherwise, you are just being given an hour to teach palliative care or end of life care. Unless you are trained, you don't know what you're going. It is on individual faculty's preferences. Like if I don't like morphine, I don't like morphine. That's what I'm going to teach. I think morphine is addictive, cannot be used for breathlessness. That's what I'm going to convey to the students. So this training is very important, and I hope we can work in future with NMC. If someone is having any voice there, kindly be in touch with us. Thank you so much, Dr. Funi. Any last comments? Otherwise, we can wind up today's session or this program.
With one more thing, most of us are there in many of the institutions where we saw that we have a crunch of specialists. So now, because of electives and other things, and also certain private institutions, we have an opportunity to have an external faculty to become part, as Manipal has it. So they do have multiple faculties. So we also would like to have certain offerings in that kind of mean, we don't have a palliative department, but then we have come forward to have a cooperative kind of involvement from each department. Then we would also be keen on having external faculties who can guide us in sharing their experience. So I feel that such special interest group should be formed in most of the institutes, and where Pallium India can offer most of their experts. I mean, we are all there for like having. We'll be happy to have such a kind of support. So such special interest groups in each institutes can be a base for development of palliative care. That's what the
Yes,
message.
yes. So there is a provision to call adjunct faculty for teaching all these topics in the new curriculum. So we do that in the nearby medical college. We do get invitations, and as you mentioned, we have partners across the states. So whichever state you are in, I can put you in touch with the experts there who will be able to come and take a few sessions. Like we said right now, end of life care session. If you need to arrange a panel discussion, just let me know. I can put you in touch with the right people who actually do such sessions. Or if you are planning to do one session on pain management, I can put you in touch with the expert in your own state so that they can come and do the lecture. That's quite possible. So please reach out to us if you want some help in terms of providing faculty to these sessions. We are happy to help. We have partners in all the states for training. So, and any of you would like to have a hands-on training for the foundation course, what you have done, I'm sure there is a list which was passed on to you with a lot of hands-on training partners in each state during the foundation course. Go through that document, choose any institute that you want to spend a week, 10 days, a few days to see how palliative care is being actually delivered. If your institution do not have any palliative care setup, that is one option that you can go, the hands-on training. I strongly recommend you to do at least a few days of hands-on training in the nearby institute. And everyone is welcome to Pallium, but I'm sure that it is a little far for everyone because we are on one end of the country. But we do get participants from foundation courses visiting us for a week just to see how it is being translated into practice here. That makes a lot of change and brings in a lot of confidence is what we have understood from the feedback. So try to spend a few days on hands-on training with the nearby palliative care institute and let us know if you have gone there, if you need any connection there. Thank you so much. I don't know whether there are more comments. I can't see anything on the chat, but maybe we'll be circulating one more round of post-test. This is really important. Sripriya will be behind you till we get the post-test. Otherwise, I will be asking her every hour, where is the post-test? Because from that, we have modified over a period of time this program. So based on that feedback, we really need to work on the structure of the next program, which is starting in August. So very important for us. Please feel that will be not be in the Google form. That will be a different link, but please give your honest feedback in that form. Thank you so much, all the participants. We would like to hear from you, your experience once you start teaching. Please write to me personally or email or WhatsApp on the group. It will be wonderful to know whether you have started teaching, what you have done, etc. Thank you so much, all the participants. Thank you so much, the experts for today. Dr. Baburaj, Dr. Parul, you were there for all 3 days sharing your knowledge. Thank you so much for being here. We'll all see you sometime in some other learning programs provided by us. Over to you, Sripriya.
Thank you everyone for joining in and making this an unforgettable experience for us as well. We thoroughly enjoyed interacting with you all, and this has been a great learning experience for us as well. So just hoping that whatever you have got from here, you will all keep spreading in your organizations. And a day will come when palliative care reaches every patient who is in need of the same. This is Sripriya, along with all the experienced and esteemed faculty, mentors, and Dr. Sreedevi Warrrier signing off from the Tipsy cohort. Stay connected. Take care. Bye-bye.
Thank you.
Thank you.